Good afternoon and welcome everyone to February's meeting of the local COVID Outbreak Engagement Board. First item on the agenda is notice of recording. This meeting is being recorded. It is not today being live. It's not involve a live feed today because of some technical issues with the equipment. However, the recording of this meeting will be uploaded onto YouTube subsequently. So please bear that in mind. Anybody in the meeting is entitled to record or take any photographs should you choose to do so. Could I ask, as we go through the meeting, if anybody wishes to speak or make a contribution, please indicate by raising your electronic hand. And could everybody please switch off their microphones and videos when they are not speaking, the microphones in particular, because that aids with the quality of sound over this Teams call. But by all means, do switch on both your video and your mic when you are making a contribution. Item 3 is apologies. I've received apologies from Councillor Paulette Hamilton and Dr. Munir Aslam. Are there any others? No, in which case we'll note those 2 apologies. Item 4, declarations of interest. Does anybody wish to declare an interest in respect of any of the business on today's agenda? Not seeing any hands. Minutes then, are we happy to confirm the minutes of our meeting on the 26th of January as an accurate record? If somebody who's in that meeting could just give me a nod.
Agreed.
Thank you, Paul. Which takes us to item 6, which is the COVID-19 situation update. And I will pass over to Dr. Justin Varney, who's going to provide us with this update. Justin.
Thank you, Leader. So the overview slides have been uploaded onto the website, and I'll just screen share to highlight some of the key points from them today for you. As you'll be aware, we've got a change in policy position, and Hedy and I will talk in a little bit about the update on the policy and our approach to living with COVID in terms of the public health specialist response. But overall, there is a downwards trajectory now in terms of the case numbers, and we're also seeing hospital admissions starting to fall, which is good news, and reflects the impact of the vaccine on preventing severe death and hospitalisation, which is severe illness and hospitalisation and death. And that pattern is reflected pretty much across the Black Country and Birmingham as well, which is good. What we can see also is a quite stark drop compared to previous meetings of the board in terms of the map colours and the number of cases falling quite dramatically. But we are still seeing parts of the city where we have over 100 cases in the last 7 days. And it's important to remember that we are now trying to live safely with COVID rather than saying goodbye to COVID. And while the majority of the world remain unvaccinated, it is important that we continue to act cautiously and sensibly when it comes to managing living in the presence of this severe and dangerous illness. What I will then move on to just highlight is variants of concern. Really, the Omicron variant is now the dominant variant across the UK. We continue to monitor what's known as a sub-lineage, which is a variant of Omicron called BA2. That remains relatively low in terms of the numbers in Birmingham and in the UK. Much of Europe, BA2 is now becoming the dominant strand. BA2 is slightly more infectious than the original Omicron, but doesn't seem to have other significant changes at the moment. In terms of testing, we are working with the Department of Health, and we will gradually be phasing down the testing sites across the city in line with the national announcement that testing will be changing from the 1st of April. We're still awaiting more details of how it's going to change and which groups will be eligible, and Hedy will talk to that in a little bit. And overall, we're seeing a gradual decline in testing, but we still remain higher than we were probably about 6 months ago, but we have dropped since the beginning of the year. And some of that is because people have tested positive. Some of this is around testing fatigue as well. And of course, now with the national announcement, we expect that to fall further. Moving on in terms of case demographics, we are seeing case numbers falling across all age groups, which is good. We continue to see slightly higher numbers of cases in children and young adults. And it is important to reflect that we still have some way to go, particularly with that 20 to 39 age group, in terms of increasing vaccine uptake. And although their risks of dying from COVID is much, much lower, the difference between being vaccinated and unvaccinated is that the vaccine halves your risk of dying and about reduces it by about 2/3 when it comes to hospitalization. So big reductions in terms of even the small numbers that become severely unwell. The vaccine does make a huge difference. And all of the side effects that you can get with the vaccine, those rare but significant side effects, you can catch with COVID, you can get from COVID infection itself. And the difference between the likelihood of getting them from COVID versus the vaccine is at least 40 times less common for the inflammation of the heart muscle, and over 100,000 times less common when it comes to the severe blood clots. So you are quids in when it comes to protection in terms of the vaccine. And we still have work to do with this 20 to 39 age group, because as you can see, that remains the largest number of new cases at the moment. Case numbers have really fallen when it comes to the over 60s, and that's good news. The vaccine is not perfect at stopping you catching the virus, but if you do catch it, you are less likely to pass it on if you are vaccinated. You're also, of course, much less likely to become severely sick and unwell. And where we have seen outbreaks in care homes or in elderly populations, what we're not seeing is people ending up in hospital in the way that we did before the vaccine. We continue to monitor the situation with the NHS. And one of the things that's increasingly we're looking at, keeping an eye on, is that there are people who are in hospital for other things and they've got COVID. And that continues to create some additional pressures on the NHS because of the hard work the NHS does around any infectious disease, trying to stop it spreading in the hospital. So whether it's COVID or influenza, we still have to treat these patients slightly differently so that it doesn't spread to other patients. And that does create additional pressures on the NHS, because although COVID with vaccine becomes a less serious illness, it is still an additional pressure on your body when you're trying to fight something else. So whether that's trying to heal from a broken leg or because you've gone in with a heart attack, if you've got COVID on top of it, it will make it more difficult for your body to mend itself and get better. And that's why it is important when we still consider the impact of the NHS, is it's twofold. One, managing those patients has to be done with infection control and prevention in the same way we do for other infectious diseases. But two, it means that people are likely to be in hospital longer from whatever they went in with, because the fact that they've got two things going on at once makes it harder for their body to recover. And the vaccine does make a difference for that, and that's another reason to support vaccination. Deaths are coming down, which is good, and we continue to monitor this, and we continue to remain below the 5-year average, this blue line of the 5-year average for the 5 previous years, and that continues to be going in the right direction. In terms of outbreaks and clusters in settings, those have started to come down, and we are working with UKHSA to understand what the national guidance will be around outbreak management following the discontinuation of the National Contact Tracing Service. And that's still guidance that's awaited that we hope to have over the next couple of days. And we have gradually been transitioning, and we're building towards that transition in terms of what it means for our local authority contact tracing support. And in terms of comms engagement, Damilola, who is our new consultant lead for communication engagement and the test and trace response, will talk a bit more fully about where we're looking to the future in terms of comms and engagement. But we continue to work hand in hand with the NHS around supporting the vaccine programme, but also to answer people's questions and help them navigate another period of change as we learn to live safely with COVID. And that continues to be a priority for us around how we can support local communities in understanding and navigating this changing and evolving landscape. It is highly likely that COVID will be with us for at least another year, probably another couple of years. And therefore, we will have to flex and adapt as we continue through this global pandemic. But hopefully with the protection of vaccination, we can continue to return to a more normal and freer life through the protection that it gives. So I hope that's helpful, Leader, and I'm happy to take any questions from the board.
Thanks very much, Justin. I was very, very interested in the information you're giving around the vaccine and its impact. And I know I've had this conversation with you previously, but I think it might be worth revisiting. And that is the fact that the vaccine wears off over a period of time. So all of that data you were giving about lessening the impact of going to hospital, lessening the risk of death, and the very fact that you're less likely to have some severe side effects if you're vaccinated as opposed to catching the virus itself. What is the thinking going forward about, let's say when we get to next autumn, whether there will be a need for a further booster vaccine?
Yes, thank you, Lydia. If I can share it, this is a different set of slides which we haven't included in the main set, but we will publish after the meeting. And this is a presentation that I gave recently to an ethnicity staff network for the NHS, but I think it's quite helpful in answering those questions. So in terms of the impact of the vaccine and how it changes over time, is we do see that over time, the volume of antibodies, those special attack forces you have that are particularly focused on the COVID virus itself, start to reduce. But you retain the most important bit of the defence, which is against severe illness, hospitalisation and death. And the UK HSA continues to monitor that. But what we're seeing is, and the bottom part of the table is for Omicron, which is obviously more recent, so we only have data really from December onwards about Omicron, is that about 4 to 6 months after you've had your booster, you're reducing your risk of catching COVID and having symptomatic disease by about 50%, as opposed to 60 to 65% when you had the first jab and the first protection. Your protection against hospitalisation, however, after the booster immediately is around 80 to 95%. 4 to 6 months later is still 75 to 85%. Now, we still have insufficient data on death, but what we are seeing so far is that it's a similar high level of protection against death. It would be very odd for you to be protected against severe disease and not protected against death, because it's the same mechanism protection. So that's why the government has now announced the extension of the 4th dose of the vaccine from people who have severe immunosuppression, so their immune systems don't work as effectively, to those over 75, because we want to boost back up after 6 months this defence from 75 to 85% back up to 80 to 95%. The reason that 4th dose is focused on the more elderly age group is when you look at the risk of hospitalisation and death between vaccinated and unvaccinated, and unfortunately this is just the data I have, but it's a similar parallel for people whose defence is starting to drop down, is that in the elderly population, their risk of hospitalisation, as you can see in this bottom row, 221 out of every 100,000 hospitalised following a COVID test. In those that are unvaccinated, only 83 in people who are vaccinated. When we look at deaths, the difference in death rates in the over 80s, 297 in the unvaccinated, 86 in the vaccinated, huge differences. And that's why boosting up that defence in the over 75s, unfortunately the age brackets don't quite match, but it gives you that understanding about why it's so important to do it. Even when we look at younger age groups, the risk of death between the vaccinated and unvaccinated, yes, death is much rarer linked to COVID in 18 to 29-year-olds, but the risk of death is halved by being vaccinated. It's more than halved. It's almost a fifth in 30 to 39-year-olds. And when you look at the risk of ending up in hospital, again, almost halved by having the vaccine. So big differences here. And that's why the booster programme, that 4th dose, is important. The final bit I just thought I'd add is picking up on that point about the risks of the vaccine and really trying to get across this. And I do recognise this is an area where I think we still need to do more work. The risk of a severe clot with the AstraZeneca vaccine, it's similar with Pfizer, is about 4 cases of severe blood clots in every 1 million people who have the vaccine. The risk of having the same type of severe blood clot in every 1 million people who have COVID, 165,000 people have that kind of blood clot. So with the vaccine, you've got a risk of 4 in 1 million. Catching COVID, your risk is 165,000 in 1 million. You're definitely quids in with the vaccine. When we look at myocarditis, that risk of your heart muscle becoming inflamed, and then this is something that does happen every year in the population. So we look at additional cases. What we found was that there are 40 additional cases due to people catching COVID. In comparison, for the Pfizer vaccine, there is only 1 additional case. And for the AstraZeneca vaccine, there are only 2. Now, it is true for the Moderna vaccine, which is less commonly used in the UK. There are 16 additional cases, but it is still much less common than the number of additional cases linked to COVID itself. So again, another example where, yes, there are risks with the vaccine, but your risks from catching COVID itself are much more significant. And whatever age you are, the risk from the vaccine is less than the risk from COVID itself when it comes to adults. So that's what the rationale about why we're doing the additional 4th dose is, about boosting that infection for the people that are still at highest risk of dying. But it is really about just topping up. Whether that becomes an annual programme or not sure. There is still a lot of work being done around new variants, etc. So I suspect it will. But at this stage, it's those over 75 who are 6 months after their booster, and those who are in particular clinical groups, and they will have received a letter or a text message from the NHS saying come forward for a 4th dose. So I hope that answers your question, Leader.
Thanks very much, Justin. That was really useful information. Thank you very much. I'm not seeing any further hands on this item. So thank you, Justin. We'll note your update and we'll move on to item 7, which is the vaccination rollout and uptake. And we have Paul Sheriff from NHS Birmingham and Solihull CCG, who's going to give us a verbal update on vaccination rollout. Paul? Is Paul not in the meeting?
I can't see him on the call, Leader, but he did confirm that he would be in attendance, so something must have gone wrong.
Okay, perhaps in the background, Errol, you could find out if there's an issue and whether Paul is able to attend or not. And then we'll return to this item later down the agenda if he is able to give us that update.
Okay, Leader.
Thank you. In which case then, living with COVID strategy, and we have Dr. Ihidi, who's going to give us an update on this, following on from the announcement by the Prime Minister earlier this week.
So, Leader, apologies, I've agreed with Ihidi. I'll start this item.
Okay.
For him. So apologies for the confusion there. And I will just get up the correct slide deck for us. So as colleagues will be aware, Prime Minister announced on Monday a change in direction in terms of moving forward to living with COVID, and we have pulled together for the board a summary of the position at the moment, and talking also through what our plans are for moving forward, particularly the specialist public health function. So colleagues on the board will remember we profiled our budget to give us additional protection and support for the period around the Commonwealth Games. So I'm hoping that this will now, bear with me 1 second. Right. So hopefully colleagues can now see this. Right, so in terms of the national plan, we're now moving to live safely with COVID. This is about removing some of the fines and the legislation we had about forcing people to take action. But it remains an important priority to focus on protecting those who are most vulnerable, particularly through vaccination, but also through the deployment of targeted testing and also through the targeted use of antivirals. And we are still waiting some clarity on some of the detail around that, but there is a sense emerging around which of those community groups those may be. We continue to maintain resilience, and that's about maintaining our ongoing surveillance, contingency planning, being prepared to surge things back up if we see an increase in rates or we see a new variant of threat that appears, and continuing to evolve and innovate in our responses to COVID. The steps to reduce the spread of COVID remain pretty consistent. Getting the vaccine is still the best way of reducing your risk of becoming severely unwell, but it also reduces your risk of passing it on. Washing your hands stops us picking up the virus and passing it on to our own faces, but also passing it on to other people. Wearing a mask when we're in indoor spaces, particularly crowded spaces with other people, is a good way of protecting them and protecting us. Opening windows is really important. And I think one of the key bits that we talked about before with the board is that our understanding of COVID transmission now is that it is a bit like cigarette smoke in that it can hang around like a cloud in the air. And that's where opening the windows and disrupting and breaking up that cloud is really important. And then finally, the advice is still stay at home if you've got symptoms. If you have COVID, it is like any other infectious disease. Your sensible thing to do is to stay home and not spread it to other people. And that remains the advice and the guidance from public health and from the chief medical officer. All that has changed is we're not going to turn up with the policeman and fine you if we find you outside your front door. Doesn't mean you shouldn't still stay inside. Absolutely important that we continue to operate common sense and the approach that we have always taken. If you are sick, stay at home and do not pass that sickness on to other people. The government has announced that free testing will end from the 1st of April, and that includes the stopping of regular testing of students in education settings. They've said there will be limited ongoing free testing, but we don't yet have guidance on the specific groups that are going to be eligible for free testing. There have also been some suggestions there will be free symptomatic testing for particular groups of public sector staff. Social care staff have been mentioned. There has been some discussion about NHS staff and about other essential critical service staff. But again, that is guidance still awaited. And they're starting to establish and develop a private market for lateral flow tests so that people can manage their own risk, particularly if they're going to visit vulnerable relatives, etc. And that's similar to other countries which have a more health insurance based system and the way that they've operated through much of the pandemic. The advice on self-isolation changes as of tomorrow, and the legal requirement for self-isolation finishes. There will be new public health guidance coming from government, which will still reinforce the need that if people are symptomatic or know they are positive because they have tested, they should stay home and avoid contact with others. And that's just common sense. It's the same as if you're sick with diarrhea and vomiting, or if you've got flu. It's not the time to go and visit granny. It's not the time to go to work. It's not time to go and see your friends. They won't thank you for infecting them, and it isn't the right thing to do when it comes to looking after ourselves and the people we care about. There is expected to be specific guidance for staff who work in particularly vulnerable services around what to do if they are positive, but also if they're a contact with a case, particularly a household contact with other people that are positive. And there will be further advice on that coming through. But the key message is to say that what we're moving away from is a period in which there were fines and rules to a period when it's about treat this like we would treat other infectious diseases. You don't want to give your friends and family diarrhea and vomiting. You don't want to give them COVID. It's the same kind of approach. And it is important also to mention that we are expecting new guidelines for businesses and the business responsibility, again, around infectious disease and the risk reduction steps that businesses can do to stop the spread of COVID in their business settings in the same way that they do for other infectious diseases. The key bit for the council and for its partners is around contingency planning. So the government's announcement said there will be plans in place to maintain resilience against significant resurgence of all their future variants. While the majority of the world remains unvaccinated or have low levels of vaccination, we will continue to see variants of concern appearing. And at any point in time, we may have to stand back up a full-scale response. And that could mean standing up testing sites again. It could mean standing up enforcement support again. It definitely would include standing up in-depth communication and engagement. So we have to maintain a readiness to act. And there is a significant piece of work going on in discussions between local and national government, between government agencies about how to resource that and where the responsibility lies in terms of those response to those potential pressures over the next 1 to 2 years. There will also be a public inquiry that has been announced, and the chair of the inquiry has been appointed, and we are awaiting the full terms of reference from the inquiry, which we expect later in the spring. So just moving on to so what does that mean? And the colleagues will remember that we've been talking for a while about developing our Living with COVID public health strategy, and we have profiled the budget for COVID response over until the end of September 2022, because the nature of the Commonwealth Games and the exciting opportunity it brings to the city also brings with it a potential risk. And by ensuring that we maintain our additional public health capacity and environmental health response during the period of the Games and the immediate aftermath, we will be able to step up should one of those scenarios happen where we see a resurgence of COVID or we see another health protection threat come to the city. And this is a precautionary approach, and I think a perfectly appropriate and proportionate to where we are in the cycle. If we were 3 years out from COVID, I would not be taking the same approach as Director of Public Health, and I would not be advising us in the same way. But the closeness and the global position of COVID means it's important for us to be sensible and proportionate in maintaining capacity to respond. Our objectives are to continue that response, but also to use some of the capacity that we have in the interim to increase our understanding of communities, to support the vaccination programme through engagement, but also our work on data, and to support partners in the work we do across the council in mitigating the direct and indirect impacts of COVID on health and well-being. And a very high-level way of describing this across the 4 pillars of action we've set out in the slides, but also in the supporting report, you have the Living with COVID document. And I would ask the board to approve this, or to receive and approve this approach for living with COVID, and to note the national policy and position change. As we get new guidance, we hope to come back to the next meeting of the board to set out the implications of those new guidelines in the context of testing and outbreak response. But at the moment, we're still awaiting national guidance on those policy areas. I'm happy to take any questions, Leader.
Well, thank you very much, Justin. We've got one indication. Richard Birdman.
Thanks very much, and thanks, Justin. Obviously, I appreciate that this is a national policy framework rather than something that you've devised, but I'd just like to get your comments on the issue of surveillance, because both within the national principles, that's stressed as being an ongoing priority, and you've talked about it being an ongoing priority in terms of Birmingham, which I get. What I don't get is how on earth you can have effective surveillance if you've not got widespread testing as a result of the winding down of free testing. So how can surveillance be maintained, and how can we get any kind of early warning of new variants and the particular problems of any new variants?
Justin?
Thank you, Richard. So, I mean, you're quite right. It is a challenge in the sense as we move from population testing to testing which is triggered by outbreaks or by symptoms, and we're still not clear on what the actual testing policy is going to be. There are 2 ways that I think we will maintain surveillance. So we already have a national network of what are called surveillance practices. That's how we monitor what's going on with flu. So these are GP practices where there is random sampling, and there is also surveillance of how many people are presenting with respiratory conditions. And that's the way we pick up new variants of flu, and it's the way we can keep an eye on what's happening. And those sentinel practices, they're called, are positioned to get good coverage of the country and also take into account differences in variation of population. So that's the first level we have. The second is we continue to monitor wastewater. So you remember in the overview pack, there's a map that's all to do with how the sewage systems of the city work. And that's a new method of monitoring and surveillance that came into effect, I think it was around December 2020. It feels strange. Now we're just over 2 years into the pandemic, last year and the year before. So the wastewater surveillance, as we understand it, they plan to continue that. And the wastewater surveillance has been really helpful over the last year in allowing us to benchmark how much what people flush down the toilet matches how much we're seeing from testing. And they have matched pretty closely through the pandemic, which I think is really reassuring because it does allow us to see that wastewater is a useful proxy if we're not doing population testing. The other thing that's important to mention about the wastewater testing is that wastewater also picks up variants. So one of the things we're able to see, and this was particularly helpful when Delta appeared, because by that time, most of us were doing lateral flow, and therefore not everyone was doing PCRs if they tested positive. So it's quite difficult to understand where the Delta was emerging. But because the wastewater sampling, we could find it from that. So the wastewater is also our kind of second line of surveillance defence. I think we probably will see a third line, which is around focus testing in outbreaks and how they are, how we look at variants in sampling there. But I think that's the bit that's still on the to-do list. But it will be a different type of surveillance, and it will be more akin to what we do with seasonal flu. And my hope is they'll maintain wastewater, but we're still waiting for some of this to come through. And my hope is over the next 3 to 4 weeks, we will see much more clarity in that space.
Thanks, Justin. I've not seen any further hands. I think you were asking a little earlier for us to note the position and to agree the proposed way forward, which unless anybody shouts up now, I'm going to consider we're happy to agree to.
Great.
So, thank you for that. We'll move on to the next item then, which is communication and engagement forward plan. Damilola.
Yeah. Sorry, good afternoon. I'm just trying to get my slides up.
Yeah, you were almost there, I think, and then they disappeared.
Yes. Please, can you see this?
We can't see anything at the moment.
Do you want me to share my screen, Damilola? Is that easier for you?
I can do that. Please bear with me. Yep. I think I'm sharing my slide.
Yeah, that's it. We can see that.
All right. Thank you very much. Good afternoon. And sorry about that. My name is Laila Kischindure. I'm a medical doctor and public health consultant. I recently joined the council 3 weeks ago, replacing Moduko Monijo, who was previously the consultant for comms and engagement. So today my presentation is on our forward plan. And just to quickly mention that, before the announcement 2 days ago by the Prime Minister announcing the Living with COVID strategy, our Director of Public Health and the rest of the public health team had been working tirelessly to develop our plan because we had predicted that we're nearing a point that will be required to manage COVID, like other respiratory illnesses. Just going to move to the next slide. Right. Okay. So, right. So, okay. So just to talk about what we've delivered so far, Okay, so in terms of what we delivered, our approach was centered around 3 objectives: community engagement.
I mean, Lola, it's a little difficult. You're breaking up a little bit. I wonder if it might help. Please don't take offence. I wonder if it might help if you just switch your screen off, because it's difficult to hear you at the moment.
Damilola, if I do the screen share and you talk to the slides, it may increase your bandwidth. Yeah. And if you keep your camera off, that will help you as well.
Yeah.
Yes, thank you. Okay, that's better. Thank you very much. All right, so I said I would be, sharing with you our forward plan, and that, for now we had been working tirelessly to develop a plan, because we had predicted that, we're required to manage COVID like other respiratory illnesses. So in terms of what we have delivered, so our interventions were structured around 3 main headings: community engagement, communications and marketing, and supported Birmingham system-wide delivery. We understood quite early that it was important to engage with our communities, because we all know that community engagement is one of the key principles in health protection, in health promotion. So what we did was that we focused on enhancing relationships, building trust, and making connections with our community. We commissioned 20 providers and established COVID-19 faith leaders group from diverse communities at the start of the pandemic to assist us in sharing trusted COVID information and guidance.
I'm ever so sorry about this, but you're still breaking up. It's just not possible to hear what's being said.
Shall I step in, Damilola? Apologies, I think your internet's letting us down.
Sorry.
Please, Justin.
No, it's not your fault, Damilola. It happens, unfortunately. So, as Damilola was saying, that we've had an approach so far which has been focused on community engagement, working with our communities, and we're very grateful for the work of our community COVID champions, our commission partners, and our faith leaders, working to get information out into communities in ways that they understand and is accessible and works for them, and also how they tell us what's missing, which has been really, really important part of this two-way communication. We continue the work we've done in marketing through our communications channel, and working to amplify both government messaging and the NHS messaging, and tailoring that to feedback from communities, as well as supporting information directly to staff, both in our own organisations, but also in partner organisations as well. And we continue to work very closely with the NHS around the vaccine programme and supporting the rollout of that, as well as with our education partners across the city, supporting their work. Some of the lessons that have been highlighted, and I know colleagues at previous boards have had feedback from some of the survey work that we've done with communities to understand perceptions, to understand how to address COVID fatigue, is really about trying to channel and respond to some of the information overload, framing it in the context of community participation, working with trusted voices. And I think there's a lot of reflection across the system of the city about how positive the reaction to this different approach we've taken to comms and engagement through COVID has been, and actually how well it has worked working with community leaders and with community organisations to get messages across and to hear from them how to frame those messages and what questions people have. And that's been particularly important and powerful in the vaccine programme. But there's always more that we can do. And part of the programme now, in terms of looking forward, is thinking how we use the resource that we have over the next 7 months up to the end of September to build on that learning and take it forward. And this is set out in the kind of 3 elements of the looking ahead. So one is around the vaccination programme, and we continue to be the main engine working with the NHS on community engagement, supporting action in communities of place, and we're working with the NHS on a 12-week forward plan of deployment of vaccination enhanced response. So things like pop-up vaccination sites, extended hours, and how that's adapting to the new 4th dose for the over 75s, and how we can support that in local communities with pop-up vaccine Q&A stalls and stands, with direct engagement, working in partnership with community organisations, alongside the work we have in train already with communities of identity and experience, and continuing to build our engagement approach to listening, learning and responding to what communities are telling us. The second pillar of work is around risk reduction, and this is really focusing that social marketing approach, the approach which is about working to not just give people information, but to help them and support them with the tools that make change and motivate change around reducing preventable risk factors for death and disability from COVID. They've remained consistent through the pandemic. And now, of course, we add vaccination. Being unvaccinated massively increases your risk of death or severe illness, but also being overweight or obese, smoking, having a long-term condition like high blood pressure, kidney disease or diabetes, and those conditions being poorly controlled all increase your risk. So where we can do work together to reduce that risk is really important. The second element is around ongoing engagement with community settings which are high risk. We've had a fantastic partnership with schools and education settings through the pandemic and with businesses, and we want to continue that relationship and build it moving forward around other health protection issues, so we can support them to better respond to things like diarrhea and vomiting and norovirus or seasonal influenza. There will, of course, be a strand of this work as the government defines what it wants to do with social care and how to support the social care environment to support them around the specific needs of risk reduction. And then the final strand is in relation to preparing for the Commonwealth Games and reducing common risk factors for transmission. Simple messages about hand washing that I think we've had throughout the pandemic, but perhaps have been overwhelmed by messages about face masks and vaccination, will be really important to us when we welcome many hundreds of thousands of people across the city over the span of the Commonwealth Games and the Creative Arts Festival that comes with it. And we need to be a city in which all of us wash hands before we shake hands with our visitors and our guests, so that we prevent outbreaks of disease. And it's those messages which this team will be taking forward as they move forward over the next 7 months. Alongside this, we'll be building an evaluation approach. We've done some evaluation through the last 2 years, but one of the opportunities we now have with the team is to look in more detail. How do we build an evaluation approach and how do we share that learning for the future, so that by the time we reach September, when we disband the additional capacity that we have a really robust approach to using comms, media and engagement to work with citizens to improve their lives, their health and their well-being. And we're able to demonstrate the impact and have methodologies to be able to do that. And that brings me to the final element of the work moving forward, which is about that transition. So Damilola has joined us recently to see through the transition of the team into a business as usual functions after the end of September. So over the next 6 months, she's working with the team to make sure we understand what's worked, we look at how we can exit that and how we can move that into sustainable ways of working with communities, given and recognising that we had a lot of extra money for COVID that we don't have anymore. So we have to find ways of adapting this learning and making it practical so it becomes just part of doing business in Birmingham and the way that we as the council and our partners work with communities moving forward. We've got some amazing foundations and some amazing work to build on, but there is quite a lot of work to look at how do we take that and translate it to what we can do when there isn't all this extra money and there isn't the extra urgency that COVID has brought us to be able to bring people together moving forward. So I hope the presentation's helpful. We thought it was just a useful thing to add on to the Living with COVID approach for our public health team, and helps to flesh out a little bit more for the board about how we're going to be using the additional capacity we've retained to support our response to living safely with COVID, navigating the Commonwealth Games, and ultimately building on the learning from our partnership with communities and partners to engage our citizens and to help support them through the pandemic. Happy to take any questions, Leader.
Thank you very much, Justin. I do think that communication has been excellent throughout the last 2 years and the duration of the pandemic. And I think that's very much to the credit of you and the team that have delivered this. And please do pass my congratulations on to everybody involved, because it's been a superb effort, really has. I'm not seeing any indications, so I think we'll note that update. And just before I move on to the next item, a couple of things. First of all, could I welcome Chief Superintendent Matt Share of West Midlands Police to this meeting. Matt is replacing Chief Superintendent Stephen Graham on the board. So Matt, you're very, very welcome. Good to see you. And then secondly, I've now received confirmation that Paul Sheriff is not going to be able to attend this meeting this afternoon. So therefore, we will defer item 7 until our next meeting in March. Okay, with that then we'll move on to the schools update. And we have Jaswinder to give us an update on what I think actually has been quite a challenge for this particular sector dealing with this. Over the last 2 years, they've been very, very much at the front line, and of course, having to continue the education of children and young people through some very, very difficult times. So, Jaswinder.
Thank you, Leader. If it's okay, I'll share a PowerPoint just to take the group through some statistics, which I think are always useful. Right. So in the update, we'll look at the COVID absence data, current guidance for schools, which of course, since the presentation was submitted, will alter following the Prime Minister's announcement. Current impact of COVID on schools and how we are working with Birmingham schools, particularly through Children's Trust and obviously our colleagues with public health. So let's just have a quick look at the attendance data. This is as at 10th of February 2022. And I thought it was quite useful to see how it compared with when I presented last time. So current attendance rate for Birmingham is at 89.9% compared to national figure of 89.7%. It's going up steadily. At the last presentation, just as a reminder, we were at 85.4% below the national average, below the national figure, and it's nice to see that we are now above that, and that continues as we get data on daily basis. And then just broken down by phases, as you will see, we've also put a comparator in when we presented this data back in January. It's steadily rising. Primary has gone to 9.2% from 87.7%, and so on and so forth. I won't go through each line by line, but there's a clear demonstration that we are steadily, even on sector by sector, the attendance is increasing. So what does that mean for absence, particularly COVID-related absence? It's good to see that that's on the downward. So in overall, in our state funding schools, our COVID-related absence is at 1.7 compared to the national 2.7. So again, we're seeing a good trend in terms of absence, but Lida, as you said, it's been a challenging time for schools. This is pupil absence, but of course there is managing the absence of staff as well. And when schools are pulling from the same pool of supply teaching agencies, etc. So they've really appreciated the support that they received from Birmingham Children's Trust, from various teams within education, and also from our public health colleagues. So in terms of guidance for schools, we do continue to offer regular guidance through our public health colleagues, and the latest one has just been updated, which will be released after half term, and that's in line with the new guidance that's been that's come through from the Department for Education, in line with the announcement from the Prime Minister. And we're very grateful. Justin will be holding another webinar for schools, and that really is picking up on the point on the fantastic communication that we've had with schools. And I agree with what Justin just said. it has really, we really have led the way in terms of how we've communicated with schools, and schools have appreciated that regular access to public health colleagues, and particularly to Dr. Varney, just having that opportunity to ask the questions, manage anxieties and raise concerns. So we want to continue with that as we move to living with COVID. So we will be holding another webinar after half term, inviting all schools and settings to that. The schools do have a outbreak management plan in place, and we again, as I said at the last meeting, we have shared a model document with the schools. Now, what that looks like in terms of moving towards living with COVID, whether we change that strategy and ask schools to capture COVID in their overall risk assessment under infectious diseases, that's to be discussed, and I'll be able to update the group on that when I attend the next board meeting. And then again, the last 2 bullet points, we continue to work with schools in terms of managing any local outbreaks. The next 2 slides, the period up to half term, as you said, Leader, has been very challenging for schools. There's been high case rates, outbreaks in schools, and that's required quite considerable support from our public health colleagues, and then additional measures as well. As the attendance and the absence data shows, we have seen things starting to improve in the recent weeks, and we hope that will continue when the schools return after their well-earned half-term break. And the webinar, as I said, is on the 2nd of March. It's something that's not in this information. Another webinar that we will be concentrating on, or another piece of work that we'll be concentrating on as further measures, control measures are removed from schools, is around ventilation. What does good ventilation look like? What do the schools need to do? And what support is available for academies through DFE directly, and for maintained schools through education infrastructure, which is my team. And these vulnerable pupils, again, same information that we shared with the group last time. We continue to work with our colleagues within Children's Trust, and schools are aware how to submit referrals, and they're also aware of the additional support that's available through the Children's Trust. And then the last slide, again, is just some useful links to guidance, etc. And that's the end of my presentation, Lisa, so I'm open to any questions.
Thank you very much, Jasmine. Anybody want to ask a question? Any comments? No, I'm not seeing any. Thank you very much for that, Jasmine. We will note the update, and yes, as you've been saying, it's been a tough time for schools, so we wish them all well for the future. Item 11 then is public questions, and there have been no public questions submitted for this particular meeting. So on to item 12, the test and trace budget overview. Justin.
Thank you, Leader. So a paper's been provided for today's meeting, which just gives an update on the budget planning. There are no significant variations from where we've been previously, and we continue to monitor and profile the budget across the financial years to take us through to the end of September. We know there are ongoing national discussions about the additional financial resource and pressures for local government around the ongoing response to living safely with COVID. But we are positioned well as a local authority because of the way that we've profiled this budget to see us through at least the immediate period of the Commonwealth Games, and to allow those national discussions and negotiations to play through. But I'm happy to take any questions colleagues have about the budget.
Thank you. Again, I'm not seeing any indications. It's rapidly progressing through this agenda. We're asked to note the budget update that Justin has given us, so we will do precisely that. We'll note it, and we'll move on to other urgent business. Does anybody have any other urgent business? No. In which case then, the date and time of the next meeting. The next meeting is scheduled for 2 p.m. on Wednesday, the 23rd of March. Again, for everyone's convenience, it will be an online meeting over the Teams platform. I now need to formally move the exclusion of the public because of the nature of the business to be transacted, which is exempt information. I move the public now be excluded. So, Errol, could you turn off the recording, please?